You're standing at the stove, steam fogging the window, hand hovering over the salt shaker before the soup even reaches your spoon. That tiny shake feels harmless. It's automatic. But in 2025, global health officials gave that moment a surprisingly serious second look. Most sodium advice asks for a life makeover. Cook differently, shop differently, enjoy food differently. This idea starts smaller. On January 27, 2025, WHO released guidance recommending lower sodium salt substitutes as one tool for reducing hypertension and related chronic disease risk. The swap is not exotic. It replaces some sodium chloride, regular table salt, with potassium chloride, which also tastes salty. A 2025 Lancet Global Health commentary notes, these products commonly replace about 15% to 50% of sodium chloride with potassium chloride. A tiny chemistry change, same dinner rhythm, potentially different pressure inside your blood vessels over months and years. Here's the simple version. Too much sodium can raise blood pressure in many people. Potassium may help the body handle sodium more effectively. The largest trial, the Salt Substitute and Stroke Study, enrolled 20,995 people from 600 villages in rural China. Why rural China? Because in many villages, people cooked at home and added salt directly, making the shaker a powerful intervention point. Researchers compared regular salt with a substitute containing 75% sodium chloride and 25% potassium chloride. Then they waited, not for a week, not for a trendy reset. They followed families long enough to see strokes, heart events, and deaths. Participants were either people with a prior stroke or adults at least 60 years old with high blood pressure. So this was not a study of perfectly healthy 25-year-olds. It focused on people already carrying meaningful cardiovascular risk. Stroke occurred at 29.14 events per 1,000 person years with the substitute versus 33.65 with regular salt. Major cardiovascular events and death from any cause were also lower in the salt substitute group. Because SSaSS was randomized, the evidence is stronger than a simple association. It supports a causal effect in that studied population. The NEJM authors concluded that rates of stroke, major cardiovascular events, and death were lower with salt substitute than with regular salt. For one person, the benefit may feel modest. Across millions of salty meals, small blood pressure shifts can add up. Potassium matters because your body treats sodium and potassium like a balancing act, especially in blood vessels, kidneys, and fluid regulation. WHO frames lower sodium salt substitutes as part of sodium reduction strategies, not as a standalone answer to heart disease. If you're curious, look for terms like lower sodium salt, potassium salt, sodium-reduced salt, or potassium chloride in the ingredient list. Use it as a replacement, not an excuse to shake more. The goal is less sodium overall, with some potassium added. One practical approach, swap it only where you add salt at the table or during cooking. Keep the amount familiar. Some potassium chloride can taste slightly bitter or metallic, especially if a product replaces a lot of sodium. Try it first in beans, stews, eggs, or roasted vegetables, where herbs, garlic, vinegar, and lemon can round out the flavor. Serious adverse events attributed to high potassium were not significantly higher in SSaSS, but key high-risk groups were excluded. Softly. This is the caveat that matters. If you have kidney disease, potassium salt may not be a casual pantry experiment. The ACC summary notes participants were excluded if they had chronic kidney disease or risk for hyperkalemia. Also check first if you take potassium supplements, potassium-sparing diuretics, or medications that require potassium monitoring, like some blood pressure medicines. This content is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider before making changes to your health routine. That's why the advice is both exciting and limited. A population tool can still be wrong for a particular body. A 2025 Lancet Global Health commentary emphasized the promise of potassium-enriched salts while highlighting the need to protect people at risk. If you're unsure, one useful question for your clinician is simple: is my kidney function normal enough for potassium salt? Another limitation: this swap only changes salt you control. It does not remove sodium already built into packaged and restaurant food. WHO connects sodium reduction with lowering hypertension and reducing diet-related non-communicable diseases including cardiovascular disease. High-impact places to check include soups, breads, sauces, deli meats, frozen meals, and salty snacks. Those can dominate daily sodium. Consider rinsing canned beans, choosing unsalted nuts, tasting before salting, and adding herbs before adding another pinch. The salt shaker may be the easiest door into a bigger sodium conversation. Not the whole house, but a door. In the Chinese villages, that door was unusually important because home added salt made up a large share of total intake. SSaSS recruited participants in 2014 and 2015, and the main results appeared in the New England Journal of Medicine in 2021. So the WHO guideline did not appear from nowhere. It followed years of fieldwork, follow-up, debate, and safety questions. The evidence is strongest for adults with elevated cardiovascular risk. For lower-risk people, the idea may still help, but certainty is thinner. WHO's guidance includes caution for people with kidney impairment or conditions that compromise potassium excretion. If you cook for a household, one vulnerable person changes the decision. Shared salt means shared exposure. One approach is to keep potassium salt out of shared dishes until everyone who needs medical clearance has had that conversation. A shaker swap will not change the sodium in takeout noodles, frozen pizza, or the sandwich you buy at lunch. When eating out, consider asking for sauces on the side, choosing simpler dishes, or balancing salty meals with lower sodium meals later. The biological rationale is two-sided. Less sodium may lower pressure, while more potassium can support sodium excretion in many people. But potassium is not automatically safer because it sounds nutrient-like. Dose, kidney function, and medication context all matter. Avoid stacking potassium salt with potassium supplements unless your clinician specifically says it fits your situation. At the store, compare products by ingredients. You're looking for a sodium chloride and potassium chloride blend, not just fancy sea salt. Taste adaptation is real. Many people find less salty food strange for a few days, then normal begins to move. Use acid and aroma first: lemon, lime, vinegar, garlic, ginger, chilies, dill, basil, cumin, and black pepper. Picture roasted sweet potatoes with lime and cumin. They do not need much salt because your nose is already interested. In SSaSS, serious hyperkalemia adverse events were not significantly different between groups, according to the published trial. Thoughtful, but exclusion criteria matter. If higher-risk people were mostly kept out, the trial cannot prove safety for them. Kidneys help keep potassium in range. When they cannot clear it well, extra potassium may become dangerous. If you want to ask about a product, take a photo or bring the container to your next appointment. The point is not fear, it is fit. A tool works best when it matches the person using it. ACC reports all-cause death at 39.28 per 1,000 person years with substitute versus 44.61 with regular salt. Population prevention often looks unimpressive up close. A different pinch, a quieter blood pressure trend, fewer emergencies spread across years. So one evidence-based approach is simple. Swap where safe, taste before salting, and reduce high-sodium packaged foods where you can. If your clinician says it's appropriate, try a one-week dinner experiment. Replace your usual cooking salt, but keep the amount the same. Notice the design. You are not relying on willpower at every bite. You are changing the default ingredient. Gentle laugh. And please do not shame yourself for liking salty food. Food systems, recipes, and habits trained that preference over time. That is why public health people care about pantry items. A tiny default can reach places lectures never reach. WHO published the 2025 Guideline to help countries consider lower sodium salt substitutes within broader sodium reduction efforts. If this helped you make sense of the salt aisle, consider liking or subscribing. It helps more evidence-based health conversations find people. So the story is not that salt suddenly became simple. It is that one practical substitution now has serious evidence behind it. Before trying it, especially with kidney disease or potassium-affecting medications, ask your clinician. For many others, it may be worth discussing. Better health is often less dramatic than we expect. Sometimes it starts with the same dinner, the same spoon, and a slightly different pinch. You still get to choose what belongs in your kitchen. Now you know why this quiet swap is getting attention.